Early in the pandemic, the eyes of the country were on hotspot New York City. Doctors, nurses leaving their own states to pitch in. Now, everyone is trying to put out their own fires.
There were going to be needs across our nation. I also know that there are needs home.
Travel nurse Alex Bearder is a North Carolina native who calls Lake Norman home. She spent part of her career working in Georgia's metro Atlanta region.
I've always wanted to kind of go where the need is.
Her latest assignment, treating COVID-19 patients in our area's only COVID hospital, Cone Health's Green Valley campus.
I think the benefit of a travel nurse to an organization is that we are very prepared. We're, educated and ready to work. No matter how hard kind of the conditions are, that's what we're there to do.
She's on the front lines with colleague John Ferreira, a travel nurse who had his first assignment in Greenville, North Carolina. He worked in Virginia just before coming to the Green Valley campus last April.
Traveling it's really has been rewarding because you get to go to different places, meet different people, and see what other hospitals do differently than your home hospital.
A tremendous need.
Oh, they've been a godsend.
Dr. Kenneth Remfer is the system-wide chief nurse executive. He says there are currently 363 travel nurses, about 10% of the staff.
We've got about 287 being used just to treat COVID patients, but we also have travel nurses in some of our harder to staff areas like our intensive care units and some of our progressive care units.
Getting that many on board didn't come from a quick phone call. It took weeks of planning based on projections from data scientists.
Where we can contact our provider and say, it looks like based on our forecast over the next couple of months, we'll need 10 or 15 additional nurses.
Patient needs are met.
Because we project that way, we don't find ourselves in this extraordinary crunch.
And staffing concerns like burnout, when there was already a nursing shortage, get addressed too.
Because during times like this, we ask people to pick up additional shifts. We ask them to pick up overtime, and we're very careful because we have a worker fatigue policy that requires us to stay within certain guidelines.
We don't see ourselves really as temporary, but for as long as we can kind of be a service.
We're part of their family. We're part of Cone Health. They don't say you're a traveler. They just say, welcome to Cone.